I think you all know gynecologist means the a doctor who treats pregnant women and all those women with any of the problems, like those who wants to get pregnant and those who have the diseases related to the periods and heavy bleeding and all like that. So what I want to tell to the Bhatkal people is I am working since 3 months in this Mariam nursing home, and I have got a very great experience in the locality because of the good knowledgeable people around here, and the experience in the hospital with the staff and the patients is really good. And we have conducted a good number of deliveries for a new person like me here. People from Bhatkal have really accepted the new doctor in a very nice way, because one good thing about the people from here is they just don't see the number of years of experience the doctor has. They see the actual knowledge in a doctor, and they want to know the disease what they are having. Just giving the treatment and giving some tablets is not enough for any patient to cure the disease. It is to every patient wants to know what they are consuming, like why they are taking, how many days they want to take, and what results they are supposed to expect. That way I felt really good, because every patient has to know why they are consuming those tablets, and how long they are supposed to take and why they are supposed to take also. And most of the time why this happens also they should know. In a low educated people, it is very difficult for them to know, to tell them they take these tablets, you have this disease, you have that disease. But people from Bhatkal are really very nicely educated, so they do understand when a doctor tells what has happened to them. That way it is really good. And among the pregnant patients, what I have seen is whenever we tell them to come in a particular time, they come in at the correct time. And when we tell them this time you are supposed to get this done, this time you are supposed to get this done, they will know why they are supposed to do, and they will do it nicely. So that is the one good thing. And also during pain of the delivery, and also they come in at the exact right time, nice time, and they listen to the doctor nicely. So only we are able to conduct most of the high risk pregnancies also, not just the low risk one. So I was able to conduct a good number of deliveries with the high risk cases also. So we avoided referring the cases to the higher center like Manipal and Mangalore. Really recently it was a very good experience in such way. When I came here, I was thinking I will be delivering only no risk cases or low risk cases. But after I got here, when I am able to make the patients understand about their situation, then I can continue to conduct high risk deliveries also. So that way. And a few of the advices I want to give to the pregnant women is, especially those who are nearing the delivery date, about their nutrition and sleep. They have to get at least 8 hours of sleep in the night and 2 hours of sleep in the noon. And about the food habits also, they do have a really good food habits here, because they consume non-vegetarian diet and fish and all. That is really good for the pregnancy, that they can continue. And sleeping hours has to be extended from different from the normal person. They do have to sleep more, and while sleeping they will have to sleep on the left side. That will increase the blood flow to the baby, that will increase the weight of the baby also. And few exercises also patients have to do, unless they have any risky situation and the doctor has told not to do any exercises. They can continue to do the exercises of the legs and the arms, and some pelvic exercises like sitting down on the floor and cleaning the floor. Those things really help for the women to go for a normal delivery. And another thing is, most of the patients eat non-veg here, so they will be constipated and difficulty in passing motion and all. So for that also, like increasing the vegetables in the diet, that will improve. Most of the time they will be consuming the non-veg diet, so because of that they will have the problem. So eating the raw vegetables like radish, carrot and cucumber, these things will improve the bowel motility and motion problems will be cleared for you. Another thing I want to tell is for the people who are trying to conceive, and one thing is we are having so many patients now and getting treatment for conceiving, but the thing is everyone comes only for 1 or 2 months, and later that okay, they will think that I am not going to get pregnant and leave it like that. And one thing is 1 or 2 months we will just know that what is the cause why you are not getting pregnant since so many years. So it is better to give try for at least 5 to 6 months, so that exactly we can come to a conclusion what is the problem also. Not just getting pregnant, like in 100 people 50% might get conceived with a normal treatment, another 50% have to know what the problem is. So that also I want to give the suggestion that like at least take a treatment 5 to 6 months like that, so that we will know what the problem is also.